Good morning. My name is Brandon Bernatowitz, and I'm enthusiastic to review some of our growing health and wellness concerns and elucidate the evidence-based best practices to help attenuate occupational-related health incidents within our company. Many of our vested workers have reported a multiplicity of symptoms associated with workplace conditions, and I intend to help ameliorate and provide strategies to address these concerns. Occupational health hazards and injuries. Occupational health hazards in the workplace are common in organizational settings. However, their ubiquitous nature is not an excuse for negligence and ignorance of best practices that can attenuate workplace health adversities. The extant literature suggests that occupational health hazards and injuries account for nearly 6% of deaths worldwide. Although these are extreme cases, I intend to explicate the multiplicity of occupational health hazards that workers may face in their corresponding vocations and outline the preventive strategies that administrations can diffuse through their policy prescriptions to help reduce adverse health-related conditions in their organizations as promulgated by occupational scholarship. Unintentional injuries afflict occupational workers through a variety of pathways. Toxic inhalation, environmental exposures to hazardous materials, and physical injuries are notable ways, among others, that plague industrial working staff members. Unfortunately, these unintentional workplace hazards possess long-term health-related risks if they are not properly attended to. Disease and illnesses, environmental exposure through inhalation and direct contact can manifest in unfavorable health conditions. For example, the inhalation of common toxicants found in residential and commercial structures, such as asbestos and lead, can cause lung cancer, mesothelioma, and respiratory conditions to emerge. These are enduring malignant conditions that account for the formally explained morbidity rates among occupational workers. Next, respiratory conditions. The poisoning effects of toxic inhalation result in negative respiratory response in a marked way. Those who do not take requisite precautions may risk enduring respiratory health conditions such as COPD, pneumoconiosis, and asbestosis. Pneumoconiosis is characterized by the accumulation of dust in the lungs that results in labored breathing, whereas asbestosis is characterized by the development of scar tissue in the lungs caused by inhalation of asbestos fibers. Beyond disease and unintentional injuries, additional environmental exposures exist that can cause chronic, unfavorable outcomes. Noise exposure. Excessively loud sounds produced by mechanical equipment and other vibrations are particularly troublesome, especially to those who work in construction trades. Chronic exposure to loud noises for extended periods of time can lead to hearing loss, reductions in performance, and perhaps even psychological comorbidities, as the literature suggests. In fact, most of the aforementioned occupational hazards possess latent effects that negatively impact psychological health, one of the primary domains that will be explicated in this presentation. Psychological comorbidities. Considering the plethora of health-related adversities that afflict occupational workers as previously presented, it is unsurprising that negative psychological corollaries may emerge as a result of their negative work-life impact. Due to the accumulation of unintentional injuries, disease, illness, and environmental exposures, psychological comorbidities can develop such as anxiety, depression, and work-related stress. As stress and psychological health deteriorate, I posit that a cyclical effect will emerge in relation to vocational injury. Occupational hazards that result in illness and adverse conditions result in emotional and mental turmoil, which can lead to poor concentration, focus, and potential injury. In other words, workplace hazards and injuries cause stress, and stress potentiates risk for injury. Chronic anxiety. Workplace anxiety, much like the latter topic of stress that will be discussed shortly, is one that we must all contend with, irrespective of vocation. Anxiety is a normal human response to stress. However, chronic anxiety in the workplace can cause adverse occupational performance issues. Anxiety is an artifact of stress and is caused by the activation of the sympathetic nervous response, otherwise known as the fight or flight response, and can result in excessive apprehension and physical discomfort due to an individual's appraisal of potential future threats. Anxiety is typically accompanied by other peripheral comorbidities, most notably depression. An additional psychological factor attributed to workplace hazards and illnesses is depression. Although anxiety and depression typically endure contemporaneously, depression is characterized by feelings of hopelessness, fatigue, loss of interest, and can psychologically erode the mental constitution within occupational workers. Moreover, the connective tissue that binds the aforementioned psychological impairments such as anxiety and depression is chronic workplace stress. Stress in the workplace is a fundamental reality that every working member, irrespective of vocation, must contend with. Chronic workplace stress can lead to psychological impairment, much like the formerly discussed anxiety and depression, poor health outcomes, unintentional injuries, and overall workplace dissatisfaction. Occupational stress is a ubiquitous gauntlet that can lead to a variety of unfavorable outcomes. It is incumbent upon occupational administration, staff, and workers to apprehend best practices and apply preventive strategies to not only attenuate the effects of workplace stress, but to vanguard against environmental exposures, unintentional injuries, disease, and illnesses. Fortunately, occupational prevention strategies exist and can help mitigate the adverse effects imparted by occupational hazards and injuries. Notable strategies include the use of personal protective equipment, stress management techniques, engineering controls, modifications to workplace practices, and administrative controls. Although it may be difficult to completely eliminate occupational hazards, the aforementioned strategies provide an effective foundation for organizational administrators and staff to consider. An obvious and commonly used protection protocol is the employment of personal protective equipment, or PPE. Personal protective equipment includes items such as face masks that reduce inhalation of toxicants, ear protection to reduce auditory disruptions, and protective clothing that creates barriers that shield workers from potentially hazardous physical exposures. It is important that occupational staff remain mindful, prudent, and faithfully apply PPE when necessary. It is an easy yet sometimes overlooked procedure that staff would be wise to follow. Stress management. Next, another salient strategy that employees can leverage to their advantage, which can help bolster their mental fortitude and reduce perceived stress, is the use of stress management techniques. Mindfulness training, physical activity, and therapeutic programs such as cognitive behavioral therapy have been well documented to reduce chronic stress, help individuals develop effective coping strategies, and attenuate the adverse effects of work-related stress. Oftentimes, psychological effects develop slowly over time and accumulate incrementally, which is why it is important for workers to self-reflect and seek mental health assistance when stressors begin to emerge and become overwhelming. Engineering controls. At the operational level, preventive prescriptions can be implemented to help diminish equipment-related work hazards produced by loud machinery and a stymied work atmosphere. Engineering controls are such a preventive measure characterized by the implementation of quieter machines, updating physical protection guards for precarious equipment, and improving ventilation standards in confined spaces to help reduce airborne particulates and dust produced from industrial processes. Providing a safe, controlled working environment free of unnecessary noise and ambient airborne toxicants should be a priority for all industrial enterprises. Additionally, organizational administrators can develop alternative occupational practices that are conducive to an optimal workplace environment by educating their employees and modifying suboptimal procedural standards. Best practices such as providing educational training, improving safety protocols, and refining work procedures can bolster the effort of mitigating occupational hazards that afflict personnel. The more informed and trained occupational personnel are, the less likely unintended injuries and workplace calamities will occur. And this begins with the proper training and the faithful integration of safe procedures that supervisors must consistently maintain. Administrative controls. Lastly, industrial authorities with the administrative office should become mindful of the personnel and schedules under their employee and supervision. Modifying and establishing consistent working shifts and employee schedule rotations must be adhered to in order to avoid overexposure to elevated occupational hazards to the same team or milieu of workers. Although not all hazards can be eliminated, as this is part and parcel of specific vocational duties by their nature, it is a salient point to note that administrators remain mindful of their employed workforce and the schedules that dictate their position within the industry. Beyond environmental and physical hazards that contribute to adverse health conditions in the workplace, social factors also influence occupational challenges. Individuals may become prone to workplace hazards resulting from stress within their personal domestic life, disagreeable coworkers, and conflicts with supervisors. It is prudent that organizational team leaders and supervisors remain aware of conflicts that may emerge within the workplace and quickly resolve internal disputes to maintain employee morale and focus. Considering the abundance of information contained in the previously described occupational domains relating to risk and injury, how can industry administrators accurately evaluate employees who are afflicted by workplace stress, hazards, and exposures? Exposure assessments provide a systematic process that identifies risks of exposure, the pathways by which the exposure propagates, and quantifies the amount of toxicants that the employee was exposed to. These assessments should be implemented consistently to evaluate employee exposure metrics. In this case, administration can diffuse appropriate modifications to industrial standards and allow remediation and prevention of workplace hazards to prevail in occupational settings. Lastly, an important question remains: how can we effectively promote employee engagement in workplace safety protocols so that the previously established preventions can be maintained consistently? It has been well suggested by contemporary literature that two notable approaches to engage employee participation in workplace safety protocols are through organizational support from supervisory leadership and the establishment of a trusting workplace culture that stimulates occupational safety awareness. Workplace safety begins with the dissemination of training, education, and culture by occupational leaders, but the cooperation and conscientiousness of line staff perpetuates the culture ethos. To recapitulate, occupational health hazards and injuries are a significant concern for organizational workers because their health and well-being are directly affected by environmental, physical, and pathogenic exposures in the workplace. The prevention and mitigation of occupational hazards and illnesses are cooperative organizational efforts. This presentation emphasizes a genuine initiative toward employee-centered care and offers a variety of effective strategies to reduce occupational hazards and bolster vocational health and wellness. It is incumbent upon administrators, managers, and line staff to faithfully cohere to safety protocols and adopt individual responsibility for applying best practices to reduce and prevent workplace injuries and incidents. Thank you.